Good morning. I am Dr. Othonos, President of the Homeopathic Academy, and we continue with the free international e-learning project of the Homeopathic Academy. This is the 29th lesson, and we continue with subjects that have to do with the homeopathic therapeutics. This is the third lesson that concerns homeopathic therapeutics. At the first lesson we have talked about the follow-up second prescription. At the previous lesson we have talked about the law of the direction of health and illness, about the pharmaceutical proving, and about the therapeutic aggravation. Now we continue with matters that have to do with potency selection, repetition of the homeopathic remedy, antidotes, complements, remedies that follow well, affinities, inimicals, duration, and parallel treatment. All these things have to do with what we call therapeutics, that is, how to treat the patient and complete the cure. They also have to do with the homeopathic laws and the universal laws, although we also have techniques that are based on clinical experience. Nevertheless, these techniques, although based also on clinical experience, should also be based primarily on the homeopathic therapeutic laws. Only then we don't do things that are subjective. Only then we are closer to truth and reality. Only when we follow the homeopathic laws and we follow the holistic thinking that is based on homeopathic laws. You see, therapeutics is the field where subjectivity is more prone to exist. So we should be more strict in the application of the homeopathic laws if we want to be correct and therapeutically effective. Now, let's take each one of these issues and analyze it. You can read details on these subjects on the relative books that have been translated to English, and especially the book Incidents During Homeopathic Treatment. I don't think it's not that what I propose as a technique are the one and only truth. There is area and there is room for many opinions, and these opinions doesn't mean that they are not. There is only one correct and all the others are wrong. Nevertheless, there are some that are closer to truth and others that are far away from truth. So what finally is the criterion is the therapeutic results. White cat, black cat. If it catches mice, it's a good cat. And the more good cat, the better cat is the one that catches more mice. So it's all about the therapeutic results, as long as it is according to the homeopathic laws. Because as we have analyzed in previous lectures, previous lessons, allopathy says that it has results, but we cannot name as therapeutic results the suppression of symptoms or the alleviation of symptoms or the suppression of the illness in general. Some homeopathic doctors talk about results, but they only refer to the cure of the acute illness. While in classical miasmatic constitutional homeopathy that we teach here in the Homeopathic Academy, we always refer to we always focus on the cure, the complete cure, the holistic cure of the chronic predispositions of the individual. So, potency selection. In order to give answers to what potency to select, apart from clinical experience, we have to apply the homeopathic laws. One such law is the law of similarity that tells us in therapeutics that we should not only be similar, have complete similarity as concerns miasms and constitutions, but we also have to be similar concerning level of tuning, the level of vibration. Our remedy has to be similar with the main constitutional influence picture of the patient, but it has also to be similar with the level of vibration at that moment of the patient. When Hahnemann started the homeopathic treatment, he used low potencies, that is the 6th, the 12th, and then the 13th. And from my research and clinical experience, these potencies were good enough, especially the 13th and maybe the 200th later, to the acute illness, to the vibration of the acute illness, that mainly refer to the physical level and sometimes to the characteristic pictures that we have from the psychological level at the acute stage due to the turmoil, the acute turmoil of the organism. For example, Hahnemann treated pneumonias, common colds, with the 30th potency, and he said what kind of characteristic pictures of pneumonia we have. We have the characteristic picture of the pneumonia of Lycobodium, of Arsenicum, of Aconitum, of Belladonna, and so on. So I should give the remedy that suits this characteristic picture. Other times, in most times, we didn't have a characteristic picture on the psychological level, but when we come to Aconitum or to Arsenicum, we did have characteristic psychological pictures of psychological symptoms during the acute illness. Then Kent first introduced the higher potencies, the 201M, 10M, and later other homeopathic doctors introduced the even higher potencies. There is a question: when do we stop? We shouldn't be victims of the mechanical thinking. The mechanical thinking tells us, oh, we should discover thousands and millions of remedies. We will take all the plants that exist, the millions plants, all the minerals that exist, all the poisons, all the chemical remedies, and by the proving procedure we will find about their picture and we will produce the corresponding homeopathic remedy and we will have millions or at least tens of thousands of homeopathic remedies, and we will cure every single disease that exists. It's a great fallacy. A very great fallacy. We should refer to the law of the transformation of quantity to quality that we have analyzed. And by this law, we find out that, and by the law of the unity and diversity, we find out that there are certain areas of energy pathology that are similar to, that are of characteristic form. So in the end there are only a few ones, only some decades of constitutions. So there are some decades of constitutional pictures, pathological pictures, and so there are only a few decades of truly existing homeopathic remedies that have full similarity with naturally existing pathology pictures concerning chronic illness, and some decades for or hundreds for acute illnesses. So accordingly, using the implementation of the application of the same homeopathic laws, during pathology there are certain vibrations, frequencies that correspond to certain states. So if we have here the spectrum, we could say the spectrum of potencies we start from potency 1 to the infinite potency. We could for years do dilution and saccution and come to infinite numbers of potencies. Is this meaningful? Does this have an impact, a real impact on treating, on therapy, on cure? Should we implement potency 1, potency 2, potency 33, potency 257, potency 2048, and so on? What is the meaning of this? In clinical practice, when Hahnemann started homeopathy, they found out that the 30th potency had a certain therapeutic application, the 30th. and so did the 200th. There was this area that meant something and that took a certain specific form. Then we had the 1M area, the 1000th and the 10th M area. And then we had the higher ones. There we had the area of 6 or 12 decimal, or the CH or CH area. It was the area that Schussler dealt with, and he developed a different kind of different therapeutic system based on this level of potentization. Schussler was a student of Hahnemann, and he was a homeopathic doctor first before turning to the system of biochemical salts. So from the clinical practice we have some information, some data. I was troubled enough what potency to use. And during the 30 years of my clinical practice, I have come to the point of having quite a lot information about potencies. So I have also been troubled to see if this clinical experience had to do with homeopathic laws and it was right to treat the patient accordingly. So my conclusions were that when you treat chronic illness, when you treat characteristics, the 1M is the main potency that, when used in clinical practice, can give very good results. Rarely I use 10M in acute psychological illnesses. For example, ignacia, love disappointments, aconitum, ailments after fright. The 1M is the main constitution the main potency that I use in all cases, even independently of age, gender, severity of illness, and so on. Why? Because I always refer to the state of clinical health. I have found that 1M, as Ken has also found, 1M can go deeper and can remove chronic predispositions. We will analyze it further, but first of all, let's talk about this area. this area of the 30 CH that Hahnemann used is the area of acute illness, that is, of symptoms. Area of acute illness. And this is the area of the biochemical level. When we come to these potentizations, to these potencies, we still have, on the remedy that we give, we still have molecules, material. We have a mixed stage of material remedy and etheric remedy due to potentization. So we act on the biochemical level by two ways: by giving molecules that the organism doesn't have in abundance, and when we give the 12 Schussler salts, and by tricking the organism by stimulation through the potentized remedy, we stimulate the onset of those therapeutic mechanisms that can bring back order at the biochemical level. For example, if we have a disorder on the plane, on the field of natrium, of potassium, sodium pump, that regulates the equilibrium of water in the cells or outside of the cells, then the biochemical salt of natrium muriaticum having both molecules and etheric energy as a remedy will bring back balance to this level, and this balance will bring improvement in many symptoms or diseases of the physical level, and has also an impact partly, very partly, on the psychological level, as at least Schussler and other colleagues of his have shown. Nevertheless, this is not our main interest, because we don't practice Schussler salt, we practice and teach homeopathy. But it is very important in order to understand what we are facing when we come to the subject of potency. So let's go to homeopathy. When we come to homeopathy, from my experience, at the 30th potency, we only have, if we give a remedy at the 30th potency, we only have etheric energy, etheric action. We act on the vital force. There is a naturally existing difference between acute illness and chronic illness. When we speak about chronic illness, we speak about the state of clinical health, as we say in allopathic medicine, or the pathology phase A, as I call it. So it's quite different from the stage of acute illness where we have an acute exacerbation of the chronic illness due to conditions that cause these acute symptoms, extreme conditions from the environment or from the internal environment or from the psychology. So it's logical to use different potencies at the acute illness and different at the chronic illness. So from my experience, I use the 30th for the acute illnesses mostly and the 1M for the chronic illness. Nevertheless, whenever we have a characteristic psychological picture, we could also use 1M for acute illnesses, because 1M goes to the psychological level also, while 30CH is more suited to the physical level. I have also tried to give higher potencies, 50M and so on, but I have seen from my experience, that doesn't mean that I am right, that I know all things. I only talk about what I know very well and have practiced very well. I have seen that there is no change in the application, or sometimes when I gave 10M or 50M that were not similar, there was no result. So gradually I stopped giving 10M or 50M, and again I did have good results and nothing wrong, nothing negative has happened, or I didn't find any use for these higher potencies, because there are limitations. According to the law of transformation of quality to quantity to quality, quality takes certain forms that have meaning, that are characteristic. Let me remind you of the spectrum of the electromagnetic spectrum that has different characteristic forms at certain areas of the spectrum. So, from my experience, I use 30CH for acute illness, 1M for chronic illness. Rarely I give 10M in acute psychological illnesses, for example, ignasia conitum. But mostly I give 1M. When we prescribe 1M, I avoid prescribing 1M to acute illnesses frequently. I only do it when there is a characteristic psychological picture, because as we have talked in the previous lesson about pharmaceutical proving, when you give high potencies very frequently, you may, and this remedy that you are giving is not only not the decilimium, but an irrelevant or opposite remedy, then you may have a pharmaceutical proving. So you can avoid pharmaceutical provings by giving 1M mainly to chronic illness and not repeating the high dose, the high potency frequently. Now, let's see some more things about this. What I wanted to emphasize is that we should not think materialistically. We should think in a holistic way, in an energy way. Because if we think with the allopathic materialistic way, we should say that the higher the potency, the greater the result. That's wrong. The more similar the potency, the better the results. It has to do with quality, not with quantity. Now, repetition of homeopathic remedies. From my clinical experience, repetition of the same or change of the remedy. We see a person the homeopathic treatment starts here. This is the first month. First month of treatment. We give our remedy and the patient starts getting well. We tell him to call us at the 15th day and tell us how he is. He is better. We say, okay, we don't change anything. He consults us at the first month and he is better. We don't change the remedy. We don't repeat it. I will not repeat what we have said in the first lesson about homeopathic therapeutics. What do we do when the patient gets better 3, better 2, better 1, he's the same or he's worse? We have talked about it. But we will talk about repetition. If the patient, after getting better 3, starts declining, then we have the second month. Starts declining, but not much. We take the case again, and if he is the same remedy, if he has the same constitutional influence, we may repeat the remedy. And by repeating it, we have again this thing. Then we have the 3rd month, the 4th month, and so on. The patient may stay well. We don't repeat the remedy. We have to apply the law of Kent, the rule of Kent. Wait, wait, wait. Whenever our patient is balanced, there is no acute or chronic disorder for whom to prescribe for. If we prescribe, we don't have a similarity. Whenever you have the disorder, then I can give a similar remedy to the disorder and fix it. You see, there are some patients and some doctors that say that I got very well with this remedy. Why not take it every week, every day, every hour? If I take it more frequently, then I will get better, because he believes that I have, let's say, a kilo of energy, and when you give me another kilo, I have 2 kilos of energy. If you give me another 10 kilos, I have 12 kilos of energy. But this is the materialistic thinking that has to do with quantity. Here we have the holistic thinking that has to do with quality. Let me give you an example. If you have your car and you press the pedal of the gas, then the more you press it, quantity, the more the engine roars and the more you run fast. But this is a mechanical phenomenon. Let me give another example. If you have a mobile phone and you charge the battery, up to a point, the more you charge the battery, the more fully charged is the battery. But there comes a time that if you continue charging the battery, there is a limitation. Even if you charge it for hours, days, years, it will only come to a point that it will be charged up to close to 100% from zero. This is the area that has if the battery is discharged, let's say if it has only 10% of its charge, the mobile phone may not work from, let's say, 3 volts downwards. There is no function. In order for the mobile phone to work properly, you have to have more than 3 volts up to 4 volts. This is the area of the function. When you charge the battery over 3 volts, you have the same result if you're up to 4 volts. If it is 3 volts, 3.1, 3.2 up to 4 volts, you have a function. If you have more than 4 volts, then you may destroy or burn the mobile phone. So you see, there is from the nature a certain area that things work properly because they are similar. But we don't have the quantity rules. We have the quality rules. From this to this area, it's okay. If you have 3.5, if you have 4 volts, you don't have extra function of the mobile phone. You have the same function. So, in the same way, that doesn't mean that if I give every day the energy of the homeopathic remedy to the patient, that his vital force will function 10 times more, 20 times more. It's not a matter of quality, it's a quantity, it's a matter of quality. You see, we have, and we don't have only quantity of vital force. We have, what's more important is the flow, the free flow of the etheric energy of the vital force in our body. So, since the homeopathic remedy is of energy nature, then we don't have rules of quantity, we have rules of quality and similarity. So you see, there is no point on repeating a remedy if the patient is well. In the same way, there is no point of putting your mobile phone to be charged when the charging of the batteries is from 80 to 70, 20% to 100%. If your vital force is good and working from, let's say, 80 to 100% and is balanced, you don't have to recharge. You don't have to give again the same remedy. If it falls, let's say, if it is worse 1 or worse 2, then you can recharge because you start having disorder again. Let me give you an example. You have a patient and he is better 3. All his symptoms are improved. But there comes a time, because of stress and other things, that he is starting to get discharged. He is worse 1. That means that he started having headaches again, if headaches were his main problem, but not so frequently as before. He starts having again stress. He is worse physically and psychologically, but not as he was before. Then you can recharge with the same remedy only if we have the same constitutional effect, only if we have the similarity. So we only repeat the same remedy if the patient is influenced by the same corresponding constitution, and only if the patient starts falling and we see that he has not the ability to come up again. Or we may change the remedy, we have a different kind of disorder. Then we try again to give the similar to that disorder. That is the rule for repetition. So we don't give the remedy again and again. There is no meaning, and we have the risk of causing pharmaceutical proving, not if we give the same remedy that is similar to the patient, but if we give a remedy high in potency, quite frequent, and it is a remedy that is not similar, but it is opposited, quite irrelevant from the similitude. Sometimes, some people say that if you give very high dosages, potencies, then you may have a very intense homeopathic aggravation. Partly it's true. From my experience, when I I have explained in the previous lessons what therapeutic aggravation is, that it is never dangerous, never dangerous. I disagree with Kent that you can harm with the homeopathic remedy, or you can cause sometimes death when you have, for example, pneumonia, tuberculosis at the final stage, and then if you give silica or something else, or phosphorus or something else, then you may cause fatal or dangerous things. I disagree. You can do that only if you insist giving 30 CH irrelevant remedies. But even then, I disagree that there is a danger. Because we act on the etheric energy, and we may make a mess on the etheric level, but we don't have dangerous situations on the physical level. So, when we have children, when I have a child with eczema, intense eczema, then because I know that we may have a therapeutic aggravation, his eczema will primarily become worse and then get better, in order not to create a burden to my child patient and in order not to have the parents worried very much, then I may not give 1M. I always talk about chronic prescribing. I may give 200 CH for the beginning, in order not to have an intense therapeutic aggravation, in order not to burden the patient. Then, when my patient is improved, both at the physical level and at the psychological level, I may give 1M. I go gradually, but only in such cases and very rarely. Usually, I give 1M to all ages and to all severe diseases, but I give the 30 CH usually at acute illnesses. So in chronic illnesses, 1M, in acute illnesses, 30 CH. When in chronic illnesses, I told you when to repeat the remedy. In acute illnesses,